You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your privates, helping you get in the know down below.
Hey guys, it's Dr. Susie G here, and welcome to another In Your Pants podcast. I'm so glad that you are able to join us today. On today's show, we are talking about contemplative and movement-based pain care. And to help me do this, I've got a very special guest. His name is Neil Pearson. I'll get to his wonderful bio in just a second, but I wanted to just share some of the key points that we'll be talking about on the show today. We'll be talking about pain education and science and biology, what it is. This is a very big topic, and we're going to try to bring it into a very digestible and manageable way of explaining it, but not just to give you information, but also to help transform your experience, because pain education and pain care should be about helping you to experience the possibility of pain changing in your world. So Neil and I discuss a lot of the factors associated with our lived experience with pain and some of the many different interconnected collections of processes that are involved with our pain experience. So without further ado, let me formally introduce Neil before we get to the show. Neil Pearson is a physiotherapist and clinical assistant professor at University of British Columbia. He's a yoga teacher, a yoga therapist, and creator of the pain care yoga training programs for health professionals and yoga therapists. Neil is founding chair of the Physiotherapy Pain Science Division in Canada. He's the recipient of the Canadian Pain Society's Excellence in Interprofessional Pain Education Award. He's faculty in yoga therapist training programs, and he's an author. Neil develops innovative resources, collaborates in research, and offers a yearly mentorship program for health professionals and yoga practitioners seeking to enhance their therapeutic expertise. He's also the co-editor of Yoga and Science in Pain Care, Treating the Person in Pain, and Understand Pain, Live Well Again. So without further ado, I welcome Neil Pearson to the show. Welcome, Neil. Thank you so much for being in the In Your Pants podcast.
Oh, I've never been in one of those before.
You have pants, don't you?
I do. Yeah. I hadn't thought of that as an option, but yes, I do.
Awesome. Well, thank you again. Welcome. So thank you so much for taking the time to be here. And let's just start right off the bat. I'm always curious as how you find yourself in yoga therapy, from going from physiotherapy to yoga therapy. How did that all happen for you?
Right. Well, I guess I should say, so I've been a physiotherapist, physical therapist since 1985, and really started to get much more interested in chronic pain initially and helping people with persistent pain problems. And then when I started, I guess the yoga therapy piece really started when I started to work in a pain management center, a pain management clinic. And it was more of one of the cognitive behavioral therapies sort of focused clinics with lots of movement and education and breathing techniques and all those things. And so at the time I had just moved to Vancouver, and I was starting to practice yoga in classes. And the more I was practicing yoga in the classes and the more I was working in this clinic, the more I started to think there's some really amazing similarities and commonalities between these two things. And so that really got me more curious about how we could start to take what we understand from the yoga philosophy and yoga practices and integrate it with what we understood from pain management, from the lived experience of pain, and also from the science that we were learning about how pain works.
Yes, good segue into that as well. So you do really integrate the science of pain and that lived experience of pain and the meaning that someone has. Can you explain to our listeners, what is pain education? When we talk about pain education, what is it, and why is it such an effective and important aspect in pain care?
Wow, that's such a big topic, the idea of pain education. So maybe we could reframe it as, in life we have lots of experiences of pain. And we don't often take time to sit and think about what we actually think about pain. And sometimes when we do, we start to realize that our thoughts about it don't really match up with our experiences. Now, one of the simple examples would be something like a paper cut. In a paper cut, it's a relatively small injury, but it can give you a really, really big pain. Doesn't always, but it can. And we never sort of sit back and think about, well, hang on a sec, what's that mean? Because our normal thought would be that pain tells us when we've been damaged, and we have more pain when there's more damage. But if we sit and think about a paper cut, we, of course, start to realize that we haven't really considered maybe it's more complex than that. So that actually could be the framework for all pain education, or all trying to help other people understand pain, whether it's healthcare professionals who haven't really thought about what they think about pain either, or us when we are experiencing pain. It really is the idea of there's a lot of misconceptions about pain, misunderstandings. And some people would say a bigger word would be our conceptualization of pain and the lived experience of pain. And even our beliefs about and our attitudes towards recovery when there's pain in their injury. We haven't really sort of stepped back and thought about that, because we pretty much all know somebody who's been in a catastrophic injury. And even though there's been all this horrible damage to the person's muscles and joints and bones, here you've got this person, his back pretty much doing life. And so maybe there still is some pain, but that's a massive injury, and you would expect that person would be wildly disabled by it if our thought was that the amount of pain that you have should be directly related to your tissue health, right? And so we have this idea is that if the tissue has been injured, then we're always going to have pain, or it's always going to get worse. But we all know people that didn't work that way. So back to pain education is, how do we provide people with knowledge, and how do we provide people with an experience, which I think is actually more powerful. When we have an experience that's inconsistent with our previous beliefs about pain, then that allows us to sort of wonder, which is a little bit different. Because I think one of the troubles we have with pain education is sometimes a person would come up to a healthcare professional and say, well, of course I've got all this back pain. They showed me this big disc bulge on the MRI, and the person says, well, when was that done? Well, it was done a year ago. And of course, the healthcare professional now is thinking, well, because it was there a year ago, it might not need to be painful anymore. It doesn't always. Lots of people have these things and it's not painful. But if I, as a healthcare professional, jumped into starting to tell you, so you said this is why it hurts, and I say, well, no, we know that people who have this don't have to have pain. Well, that's sort of hitting a belief sort of right in the head. Whereas if you think of it a different way, so you've got that experience. If I could show you a way to move, or if I could guide you with movement, or guide you with contemplative practice in a way that at the end of it, you were experiencing that you could move with less pain. So now you've had an experience that's inconsistent with what you believed. And so you might wonder about that. Has there been some sort of weirdness happening here? Is there some, we started to almost think, is there some magic in this? Right? Is this person done something to me?
Right.
But if I could get you to have that experience repeatedly, where you were doing something that would change this pain repeatedly over time, it allows you in a very gentle way to start to reconsider that maybe your thoughts about this don't actually match up with actually human experience.
Right. And I think that's going along the lines of what we're talking about, that pain is changeable. So we're violating they call it the expectancy violation,
Right.
where it's a contradictory, right? Where you expect one thing to happen, but you change the context, or maybe someone's guiding you in a different way, or even under the radar to do something very similar to an activity that might otherwise be very threatening. And it, like you're mentioning, kind of surprises the person in a very contemplative way, like, wait, how did that happen?
Right.
And I think you're right, where it's like we need to start to create more of those positive experiences to create new memory traces, or a different type of learning for the current situation that one is finding themselves in. So,
right. I mean, the education, we have been really focusing on the cognitive education of sitting a client or a patient down and explaining it to them. And I think that's useful. And if you look at what Lorimer Moseley and David Butler have really championed, is this idea of using metaphor and story. And the cool thing about story is it's an experience. So if I can tell you a really engaging story, you get wrapped up in the story, and it becomes more of an experience than me providing you with knowledge. And that allows, once again, this more gentle ability to consider that maybe my worldview or my view of pain isn't quite accurate. Yet I think that one of the things that we need to recognize, or from us on the healthcare person side, is that what we need to do is to recognize that we're giving people experiences sometime. So if I did manual therapy on your neck, and at the end of it, you could move with more ease and have less pain. Well, this actually is a pain education moment for me to say, wow, that's amazing. Your pain changed, right? Because it doesn't always change like that. So your pain changed. And then to me, I would always throw in one other thing is, let's find all the other stuff that will do that too. Because it's one of our frameworks around pain is our idea that we're looking for the thing that changes pain. Right? We really want that because it hurts, and we want something to change it. And one of the things we haven't recognized that science really showing us, but patients have been telling this for us forever, and we really haven't been paying attention well enough, is the idea there's multiple mechanisms of physiology inside us that can actually change pain. There's not just one, right? And so when we find one thing that works, well, what we want to do is then look for other things that would have similar or maybe more or maybe less benefit and start to put them together.
Yeah, that's wonderful.
Yeah. I mean, I've heard patients say this, and it was only a couple of years ago that it stuck in the right way. As a person saying something like, when my hip's sore, I get in the bathtub and I feel better. But when it's really sore, that doesn't work. I need to get the temperature just right, and I need to put in Epsom salts, and I turn candles on, and I put aromatherapy on, and I listen to Enya, and now the pain gets better. Right? And so what the person was saying was, what I do when the pain's really bad is I layer on top of each other all these different things that all give me some pain relief, but I can put them all together and even get a better pain relief. And again, science is saying, I think this is really important for people to hear, is science is saying that there are multiple mechanisms within us. And so we want to learn many of those. And if we sort of flip back around to the yoga part, or what happens in a pain management program is people are being taught all these different techniques, because I don't know what technique will work best for you at what time in your recovery. Right. So what we do within yoga practices is we try to go in many, many doors, the same as we do within a more medical-based or psychology-based pain management program.
And I think that's really important, as you're saying, that telling people that there isn't just one path. There are maybe multiple paths and multiple layers, and those that are helping you are coaching you to figuring out, well, what's the secret sauce for you? The ingredients for your secret sauce, essentially, right? And so that's kind of what I tell people too. I'm like, I'm just giving you a flavor. These are just appetizers. I want you to try them because, as you're saying, and I totally agree, that it needs to be an inner experience that shifts them in a different direction. It's an internal experience. And what we're trying to do is find those moments or those opportunities, those teaching opportunities, and for them to actually experience it. I say you have to start to practice some of these ideas, make them your own, just really experiment with curiosity, compassion for oneself, right? Because it could be one could be easily frustrated. And I think that's a good topic to maybe kind of go in about, like, self-compassion and love as you're exploring through these, difficulties or challenges or struggles in your life, and know that just because one thing didn't work for you, it doesn't mean that nothing's going to work for you.
Right. Well, and sometimes when we try, say, a contemplative practice, or in the medical side, we call it self-care practice. So we'll use those interchangeably, like self-care and contemplative practices. So sometimes when we try them and it doesn't make a change in what we want to start. So maybe we were hoping that we'd feel calmer when we did it, or we were hoping that it might have decreased the pain, or that I'd be able to move better afterwards. Right, so we have a goal around it, and we do it once, and we don't move towards our goal. Sometimes what our experience is that this doesn't work, or I can't do it. And at this point, it sort of wraps up in the compassion side of things, but it's also a little bit of just reframing for us when this happens. Because when that happens, I'll say to the person, okay, so I've never thrown darts before. My goal is to get this dart in the center of that dartboard. It's the right distance away, but that's what my goal is. And so I throw the dart at the dartboard, and I don't even hit the board, let alone the center of it. So what should I conclude? Because when we practice a contemplative practice the first time and we don't get a change or we don't get near the goal, sometimes we conclude, I can't do it, or this isn't possible.
Mm-hmm.
But when you throw the dart at the dartboard, most people would conclude the idea is, well, I need to practice this more. Right? And I think this is one of this fits in with the compassion piece, because we often are so critical of ourselves.
Mm-hmm.
And I think that's part of, so I'm not trying to, color us or paint us in a certain way, but I think that when we've had ongoing pain, we've tried to change things so many times. And when we've tried to change things so many times, we start to feel less competent. And when we start to feel less competent, then sometimes we become less compassionate, right? And even our language starts to get odd at times, right? We talk about our bad foot or our stupid back, and this language, whenever that happens, for the yoga therapy side of me will say to the person, it's you, right? Right? You're talking about you. You're talking about a part of your body, and the best approach to this is to reconnect with it and show it. I know it sounds really woo-woo, but show yourself love. Mm-hmm. Show yourself compassion. Be nice to yourself like you would be with your best friend who's beating themselves up. Like, what would you do then? So do that for yourself. It's not the solution. And I think what a lot of people hear when we say things like that is, oh, you're just one more person just saying think positive thoughts and everything be peachy. You say, well, no, actually, it's back to the layering bit, that when we do that, that's a piece of the puzzle, or it's one of the ingredients in the secret sauce, as you said, right?
That's right. Right. And I love that, because you mentioned something important, that we try really hard to make something go away, or try really hard for something good to stay. And I think that kind of goes into the philosophy of impermanence and this constant concept of everything is always changing. Although it may not seem like it is for, someone who's really feeling like they're stuck, it may seem like things are constant or never changing, or that they're doomed. But things are changing. Like the sun is always shining, but if you're in your house and everything's boarded up and the blinds are covering the windows, you're never going to see the sun unless you start to, let some light in, essentially. It's always there. It's just how much of it are we willing to receive? And I think that might be reframing, or as you're saying, like, let's not be so afraid of it, because there's a lot of fear around pain.
Well, the one thing I was going to say is that I think one of the things that happens is that we start to feel, as you're saying, that pain is immutable, that it's not changeable. And so we can have someone talk to us about equanimity and impermanence and these things, and that can help. But once again, I would go back to, wouldn't it be amazing if we could have an experience in which the pain changes, and then have the person who's working with us, sort of have a dialogue or a discussion about the idea that look, what's happening here is that, of course pain feels like it's unchangeable, but here's an experience where it did, and let's look for some more. And because sometimes it's possible for us to partially reconceptualize, so that we start to believe that, yes, it's changeable, but until we have the experience that it actually is changeable, it really is more of an academic kind of idea. Or there are sometimes we do formal education classes where we'll have people with pain sit down, and at the beginning, at the end, we do this true or false questionnaire. And what you get some people at the end is they'll look at the questionnaire and they'll say, so do you want me to answer based on what you just told me, or based on my experience? And the first time this happened, I was like, my jaw was on the floor and I didn't know what to say. But what the person was saying is that they understood the information.
Right.
And they understood that this was possible, but they didn't believe it was happening in them. And it took me a while for me to figure that out as well. What this person needs is an experience that would be consistent with what the new information they've learned, because that's not their experience. Their experience is, what's going on in me is something different. It's something that's not changeable. I've tried all these things and nothing's working. And I think that's if we go back to the pain education, but also the contemplative practices is they're more experiential, even though both of them happen in you. I mean, this is sort of weird, right? When we try to talk about it, if you provide me with information, then, well, I'm changing. There's a change happening in me, but there's a different kind of change that happens when you provide me with an experience, right? And it gets really fascinating because sometimes people, they have the experience, but until the person understands why that could have happened, it seems too woo-woo. It doesn't feel so real. And you can put them together that way, but then sometimes we need to go the other way. For some of us, we need someone to explain to us that it's possible and this is what's happening. And then to have an experience that confirms that, right? It's sort of odd that we need to go in different pathways. And I don't even think that it's not like it's for you. You need the knowledge and then the experience afterwards. I think it's actually for the concept. So for you, sometimes you may need the knowledge first, and sometimes you need the experience first. And that's part of the reason why I love what I get to do, is because as a physical therapist, I can go in the more cognitive, knowledge-based door. And then the yoga and the yoga therapy has really opened up the door to go through the contemplative or experiential side.
Yeah. Oh my gosh. That's beautiful. And it sounds simple, but I think it's not easy, right? Especially for, healthcare providers and wellness professionals, and for those experiencing that lived experience of pain, because we try to get that experience. And sometimes, you do have to work through many layers, as you say. So Neil, in your clinical experience, how do you frame what you do with the person in front of you? Like, how do you set the stage to let them know that this is a process? Because it sounds like this is a process versus, one and done.
Yeah, true. So I'll get to the question, I think, but the bit of the process versus the immediate change, right? Is that even when I came into this, I was thinking of pain management more like a light switch. And even when it was fascinating to look back, because at first I got to the point, okay, it's not. But then I didn't realize that my language was still more like the light switch thing. Until a patient said to me one day, she said, the thing that I've learned from the experiences you've given me is that pain management or pain care, it's a dimmer switch. And she said, and we got talking about it, and she said she recognized that she started with that idea of looking for the thing that would turn it down or off. But she had learned that there was more like a dimmer switch. And she was a really, really, really sweet woman. And we actually started to have a dialogue, because she started to tell me about some of the language that I was still using that matched better with a light switch than it did with a dimmer switch. And so it was a really great learning experience, because she just had that capacity to help me. And of course, that's where I've learned most of the stuff that I've learned, is from listening to people in pain who have been gracious enough to let me sit at their feet and learn from them, rather than just doing the other way. But in terms of, that's a process. Where I am right now, it's a little bit more simple, because people come to me either to the yoga things that I do, or when I am treating people in physical therapy, which over the last couple of years I've been doing so much teaching and development that I haven't been, sort of rare that I see people one-on-one. But anyway, when people come to me in either of those places, there's sort of an expectation of what they're going to get to start with. So it's harder if you are a regular physical therapist or occupational therapist. Actually, maybe people think occupational therapists would do more of this than physical therapists.
Yes, I agree.
But when people come to a physical therapist, what they're looking for is the physical therapy treatment, the thing that would actually help the person to move with more ease, the right exercise, the kind of treatments to make them better. And in there, so I've just actually started to consult with this big Canada-wide clinic group. They got over 250 clinics, and a lot of them are physical therapists who are working in more the acute, subacute. And so we're figuring out, how do we bring this in? And so what we're talking to them about is the idea of shifting language, so that when a person comes in with your standard back pain, neck pain, shoulder pain, is you can do all the stuff you normally do. And as a patient, you want to expect all the stuff you normally do. But around the pain, what we would hope is that the person would also give you an idea that that there are things that you as an individual could do to try to change this, but also that the language you'd be hearing is a language that suggests that when a physical therapist works on your neck, does some mobilizations or something on your neck, and you have less pain and can move with more ease at the end, that the person would be talking about how this is showing that pain is changeable, and that there are, if I can do something to you to change this, let's look for the things that you can do to get a similar kind of result. So that there starts to become a conversation early on that pain's not just all about the tissue, that our protective responses, our nervous system, our immune system, and those things are important. And I mean, if I see any friends who have, stuff, and I do the typical physical therapy assessment, and I tell them the stuff to do, at the end of it, it'll all sound like your normal physical therapy, but at the end I'll say something like, there's this breathing technique I have an audio file of, and I'm going to send it to you, and I want you to listen to this and do it 5 times a day, because I know if you do that, you're actually going to change the chemistry of your body. You'll change the inflammatory chemistry of your body, and it will help healing. I can't tell you if it'll help you get better faster, but I know it helps healing. And so when I'm teaching physical therapists about doing that kind of thing, I say, I actually don't really care so much if the person does it, because they're probably going to get better without it anyway, because we do, right? We normally do get better without adding those things. But if I say that to you at the beginning, and you're not getting better like people normally get better, and now I start talking about the fact that pain doesn't just have to do with the tissue and the tissue healing. There's this other thing. Now you recognize that I'm just not making something up because my original idea didn't work.
Right.
It's actually
trust.
Yeah.
Breaks that trust.
Yeah, Lorimer Mosley made such a beautiful comment. If for the first 2 months and 29 days, all you do is talk about the tissue, and then the very next day, now it's at 3 months, and so it's now officially a chronic pain condition. You start to talk about the nervous system. How could the person believe you?
Right. Exactly. Yeah. Set the framework, set the container, make sure it's safe, obviously, and that you're building trust and that rapport between the person in front of you who's bringing strengths and weaknesses and their fears and worries and all that, and taking into consideration the entirety of the human being.
Yeah.
And as you mentioned, their lived experience and validating their experience.
That's so important.
Yeah.
And I think one of the other thing is that to reframe the things that we as physical therapists do for patients as, actually, what are we trying to get out of it? So if a physical therapist was doing one of the needling techniques like acupuncture or manual therapy, there are times that we might want to do that, or we might want to receive that, because the pain is really horrible today, and it would be really nice if somebody just made it feel better. Yeah. And so the goal right there is to actually give the person some ease, some escape. But a lot of times when you do this over time, right, when we're doing these kinds of treatments over time, the purpose of them is to help a person to move and or live with more ease. And this is another reframing that we're trying to do in this process, is to say to people, so if you were my patient, you had neck pain, I would say, I'm going to do this technique on your neck, and let's see what happens. And if it did give you less pain and more ease of movement, I would tell you that that's the purpose. The goal of this is to help you to move with more ease, right? So I'm going to help you by doing this, and then you need to do this, because it's your movement that's actually going to make you better than just me. Right. And so if the treatment that I'm doing for you is not allowing you to move or live with more ease, then we need to change the treatment, because it's not just about giving you pain relief right now. That's great, right? But what we want is, over time, is that it allows you to get back to your life, because you getting back to your life, the every aspect of you getting back to your life is going to help you get better again. And we haven't framed it well. And that's part of the teaching people about the process. And I go even further, because I work with the doctors of British Columbia, helping the family practice docs to integrate some of these things in what they do. And one of the things we do with them is say, so if you're going to write a prescription for somebody, you write it on your piece of paper and you're handing it to the person, but you don't give it to them yet. And what you say to them is, this is to help you move better. And if this hasn't helped you move better by next week, we're going to change this. So you're going to come back and see me next week. And so it's a reframing it from, rather than saying the point of this treatment is to give you less pain, the point of this treatment is to help you get back to life. And if it's not doing that, we need to change it. And so that's the that's part of the learning of the process. So as a person in pain, we need to recognize that the majority of times when we get hurt, we get better. Just the human body is so resilient, has such capacity
Amazing.
to improve and get better. But there's sometimes when we need help, right? And sometimes the help we need is just the standard, just the thing that the doctor can do temporarily, or the physical therapist, chiropractor, massage can do temporarily.
So essentially, we're not focused so much on the symptoms or the pain. We're actually trying to shift the focus to alleviating suffering or improving that person's quality of life so that they can take actionable steps to live better, move better, be better in the world, feel better about themselves and how they interact. It's not just pain and the symptoms, which a lot of us are so focused on just getting rid of. And if it's not gone, then it must not be successful. And I think that's where what you're talking about, Neil, is, shifting our framework around, well, how do we work with the person in pain? And instead of just pain and throwing the kitchen sink at symptoms, we can't compartmentalize pain or a person or even by symptoms.
Well, I think somehow we need to hold some things that feel opposite. Mm-hmm. There are times that when we're in pain, it would be really, really great if somebody could give us a hand with that pain. And then there are some times when we have pain when it's better to focus on recovering function and getting back to life, social engagement, work, all that stuff. And what we often see within the pain care world is one or the other. We're not going to, people go into a place and say, we're not going to focus on your pain here. We're just going to focus on helping you get back to life again, which cannot feel very good sometimes. Right. And then on the other side is the let's just, we're going to focus on the pain. And sometimes that works, but sometimes it creates the wrong focus, because the purpose of decreasing the pain is to help the person get back to life. So how do we do both?
Yes.
And this is problematic for us when we have ongoing pain, because at some point we start to get the spot of wondering, like, where exactly is this going? What is the outcome going to be here? And it's odd that healthcare people don't often talk to us about this part, and that we don't know for the person, when we have ongoing pain, we don't know, and the healthcare professional really cannot tell us which path we're going to go down. And we may go down the path of really the pain mostly goes away and we get pretty much everything back. Or we could go down the path of getting to a spot where we can do so much better and the pain is still there, but it doesn't bother us anywhere near like it did before. Mm-hmm. But then there's another path. And the other path is the path where the pain really hasn't changed very much, but we get our life back. Sort of despite the pain, which is such an odd thing, but we need to, as people in pain, we need to hold that that's a possibility, because there are some people in pain who will tell us exactly that story. Right. That the biggest thing that the healthcare or the yoga therapy world gave the person was the capacity to re-engage with life. Mm-hmm. And yet the pain, even, all those things they tried, the pain didn't change very much. And it's tough, because the system seems to want to decide which one are we going to work on. Right. Either we're going to just ignore the pain and just go that way, or we're going to do this other. And I would suggest that what we want to do is try to find the things that can help us find some escape and peace from the pain, and also work on getting our function and our life back at the same time. And it's almost like we need to follow two paths at the same time. And this is frustrating, because isn't medicine supposed to be certain and definitive?
Yes.
Right? Aren't we supposed to know the answers?
I need to know exactly how many hours, minutes, seconds, and days this is, it's going to take. And humans love concrete, like black and white answers. And unfortunately, pain is a phenomenon, like many things in life, and being human with its predicaments. But it's, how do we work in the face of uncertainty? Mm-hmm. How do we get comfortable with uncertainty? I know Pema Chodron, that's one of my favorite books, by the way. I'm plugging it in here. But get comfortable, or comfortable with uncertainty, Pema Chodron. But anyway, it's just really interesting how once we kind of think in different ways and kind of shape our lives with those philosophies, how things can change.
Oh, absolutely. Yeah. Yeah. I think to come back to what you said was, if the only thing we're trying to do is to change the pain, that's where we run into trouble. And I think we also get in trouble if the only thing we're trying to do is just recover function. We need to have more paths. And again, I think that's part of the reason that yoga can really work for people who want to engage in yoga. It provides different paths within it.
Mm-hmm.
Now, you've got the movement path, you've got the contemplative path, you've got the more meditative practices, you've got the self-love, compassion, practices that are aspects of the broad view of yoga.
Mm-hmm. Absolutely. And being transparent, I think you're talking about, like, as healthcare providers, it might be very difficult, because the person in front of you is looking to you for answers. And us as a provider should be okay with that uncertainty as well, of knowing, I don't know, where things will go, but I'm here to support you. I'm not here to fix you. I'm here to support you on your journey. And I like to use my hands to support you, not to fix you. And that's one thing, I think one gemstone I learned from my yoga teacher training was, like, you use your hands to support the person, not to change them, not to fix them, not to adjust them. You're there to be supportive and say, I accept you as you are, and there's no need to change your shape to be anything other than it is.
Right. Although as you said that, I was thinking the one little shift would be, a lot of times when I put my hands on people's bodies when they're doing the posture practice or move practice, it's actually to give them some biofeedback so they can adjust out. Right. So, the yoga stuff is more like moving further in. And so many times people have gone so far that they can't breathe anymore. Their body's getting all tight. And when you put your hands on a person in a certain way, sometimes that allows the person to become more aware of what they're doing in the moment and realize that, really this practice is about challenging ourselves, but still doing it from a place of some ease, or some place where you feel like you have some possibility of smiling in the midst of this.
Yes. I love that you said smiling, because playfulness, I've been doing a lot of research on my own about play and neuroplasticity in the brain. And a lot of the research comes from animals, and there's actually a cool video. If you guys look it up, it's a polar bear playing with a husky. Have you ever seen that, Neil?
Yeah, I just saw that. That's amazing.
Yeah, it's so cool that, like, you would think that, in the dead of winter in Manitoba, I think, actually in Canada, someone videotaped a polar bear and a husky playing, where you would think that would be a snack for the polar bear who's starving.
Right.
But they're waiting for the ice to freeze over again, and they just play in the most compassionate and it's just awesome. But anyway, we have a lot of play that I think gets lost as we become adults. And I think, adding music, like you mentioned earlier in our conversation, adding those layers and, making the impossible to I'm possible, and showing them that, humor and having fun can actually change the way your brain is wired. We just have to tap in what works for that person. And what does play mean for that person? When was the last time they actually played? And there is no, definitive definition of play, just like joy. It's different, but anything that brings playfulness and joy into that person's life will be supercharging their, recovery, or at least their well-being. So.
Oh, absolutely. There was a study probably 10, 12, maybe even longer years ago that it was a small one, but they took a group of men who all had low back pain for more than a couple of years. And if I remember correctly, they did a whole bunch of questionnaires, and in the midst of the questionnaires, they were looking at their pain and their mood and things like this. And then they gave them money to go see, to be part of the study. They were going to go see a movie, but they needed to take their best friend. Then they gave them money for the tickets and the popcorn and stuff. And then the next day, it had to be a comedy movie, right? And then the next day, they got them to go through these questionnaires again. And what they found was that the majority of people doing that, because you've got the laughter, right? You've got the social engagement of a really good friend, which we all know the science behind those things. But anyway, the majority of people were better. There was about 60% of people said their mood was better, their pain was less, and all this stuff. But what the scientists did that I think was really, really great is they looked at, was anybody worse? And what they found was that there was about 20% of them were worse. So I think it was 60% were better, 20% didn't change, 20% were worse, some numbers like that. And the fascinating thing about the 20% is that they did a qualitative questioning with everybody. And the people who were worse, basically the response was, don't tell me that all I need to do is laugh and smile and hang out with my friend and everything will be fine. So what the person felt was invalidated by this idea that humor would be of benefit, or social engagement would be of benefit, which of course isn't the point that we're trying to make. And I think, but I bring it up because I think it's really interesting that there are some times we're not ready for it, right? So yes, it can help, but we're in a place where, help me with my back first. And, then maybe we can move on, because a lot of times people start to get the sense that you're ignoring the problem, right? As we don't have the right framework around it. That thought is, help me with my body. And once my body is getting better, then let's add this stuff in. And I think, I say this more for the healthcare people and the yoga people who are listening is note there are sometimes you don't feel safe enough to try this yet. Now it's like the experience of, there's probably been some time in your life when something's really upset you, and someone who you love dearly is right beside you and they're telling you it's okay, to calm down. And you're sort of pushing them away because you're not ready. It doesn't feel safe to do that yet. And so we can run into this very same thing with playfulness and humor at some times. And we just need to realize that's okay. It'll work later. Once we've addressed other things, it still will give some benefit.
Right. And Neil, how do you, like for the healthcare providers and the wellness professionals, what's the best way to go about knowing when certain things are appropriate? I know there isn't a protocol, and that's not what I'm asking for, but it is, I'm just trying to maybe even make a point that it is difficult sometimes to, absolutely. You try something and it might not work, but don't be discouraged. It's a learning opportunity, a teaching opportunity to say, and to actually be honest and upfront with the person in front of you to say, okay, well, and please let me know if this doesn't work for you.
Right on. Yeah.
Right? Like permission.
So my answer would be listen and build a therapeutic alliance. But then always recognize that it's still a human being in front of you, and you only know them for a certain period of time. Yeah. And so there's a really good chance that even the breathing techniques that seem to work on lots of people, it's possible that could increase anxiety in the person in front of you, or there could be something about it that could sort of turn on the pain tune in a way that you don't really expect. And so what you just said about permission, the people we're working with need to know that they have permission to pause anytime they want and let us know it's not getting them what they want to get. I know that sounds really, really loose, but that is the point. If I'm getting you to do, if I'm as a healthcare professional showing you a technique for you to work on, if it's not getting you what you want to get, we need to know that now. Actually, if that were to happen, if you were to say, this isn't making me feel whatever, the question I would say is, if you think about what just happened, does this technique seem to be one of those things that if you keep on practicing it, it would be worthwhile, it will be helpful? Or does it seem to be one of those things that it's just going to bug you and it's not going to be of any value right now? And once again, that's loose, right? But it's amazing that so many people actually can say, oh yeah, it feels like if I work on this, it's the right thing to do. And other people, the same person another time, they're like, no, that's not doing it. And that's part of, I think, the whole point of pain care in the end is that every human is so unique that I don't know how this particular technique that I'm asking you to do or guiding you through is going to land on you. And it's not even just about you, it's about right now in your life and in your recovery process, because it's possible that the very same thing in a couple months may give you a very, very different effect because things change. And that is part of the trouble that I think we as people in pain experience, that the healthcare people, as we're starting to learn about this, we're not really thinking that way. We're thinking, I've learned these techniques that will work, and I want to give them to them because they work. And you're so focused on giving the person the technique that you're not reassessing quickly enough, right? So it's just one of those things that's so important to listen all the time, right? Because sometimes when we say to healthcare people, the most important therapeutic intervention you have is listening. And a lot of times what the person hears is, during my initial assessment, I really need to listen to the person's story. It's like, well, yeah, but you also need to listen to the person all the way through everything, and not just listen to the person's words. To watch when you can see the person holding their breath, or their body getting tight, or the legs crossing, or their arms crossing, or their eyes crossing, rolling, whatever it is, right? Because you can, when someone is saying something that makes no sense to us or feels wrong to us, there is nearly always body language. And the longer we work in this area, the more we start to notice that sooner, right? And when we're teaching yoga therapists to work one-on-one, we're absolutely, asking them to observe the person's breath, observe the person's body tension, observe the person's face, their voice. Keep on watching that stuff, because it's going to give you cues as to whether you're going down a door that's helpful, or where the person is now having to guard themselves from whatever is happening. Right?
Absolutely. Oh my gosh. Well, speaking of, I see you have your book behind you on your shelf, but you co-edited a book, which I'll just put a shout out here right now, Yoga and Science and Pain Care. It's a wonderful book. I actually have a patient who's reading it as well right now.
Wow.
So yeah, she's reading it. So it's a wonderful book. Anything else that you're doing, Neil, in the world right now? What are some projects you're involved in?
Gosh.
Or too many to say?
Well, there are a lot of them. We're actually, for quite a number of years, I've been teaching a thing that's called pain care yoga. So it's an integration of yoga with pain science, but it's really focused on yoga therapy, more of a one-on-one. And we've had a lot of people asking us over the last couple of years, what could we do around yoga teachers? So we are in the process of creating a thing called Pain Care Aware, that will be a sort of two-step learning process. Step one will be actually online. So we haven't exactly got the right number figured out yet, but it'll probably be around 15 hours of online education that yoga teachers could learn, so that they would understand the basics of pain. And the idea is if we sort of framed it in the idea would be, how as a yoga teacher do we continue to keep people safe without providing language that tells the person that they need to be too careful, or that their body is fragile or easily broken. And so we got to balance these things, right? And so we're trying to give people an understanding of, yoga teachers, an understanding of, this is what pain is, and based on this is how we would want to guide people with movement in the class to keep them safe. But also, because there will be people in your class who have pain when they're doing things, how do you bring some of this language in a way that makes sense, rather than, some of the languages, if it hurts, you shouldn't do it,
right?
Which of course is going to teach you the wrong stuff. But then, of course, there's other language that's this idea of transcending pain, that we need to get past it, which is going to get you to just endure it and push through, and actually potentially cause damage to your body if you do that sort of thing. So we need to find the balance of that. But anyway, that's Pain Care Aware. It's going to be launched really early in 2020. I just keep on working. Well, there's a lot of work that I do with healthcare professionals and with doctors, and I'm really excited. Actually, there's in the community in which I live, there's a primary care group that's being developed that will have doctor, nurse practitioner, psychologist or counselor, physical therapist, occupational therapist. And so people will actually be able to go there. And if they do need a team, there will be a team there. And so we're looking at how we could educate that group in terms of pain management, so they all be talking the same language. Because there's a huge gap between, a person has ongoing pain, they see their family doctor, or they see their physical therapist or their yoga therapist, and they're usually seeing individuals. And then beyond that, the next step is really way down the road. It's the medical interventions, or it's the multidisciplinary pain management center. And so we're trying to figure out, how do we this is one model of community-based pain care, like
Mm.
team-based pain care, because
Mhm.
people need care in their community, and it's better if we look at the resources there. So around the province of British Columbia, there's a number of us through a patient advocacy group called Pain BC
Mhm.
that we're working on different processes like that. And I guess the one other thing I just want to say really fast is that the other thing I'm doing is next year I'm going down to Australia, and I'm going to ride in the Pain Revolution.
Yay!
So the Pain Revolution, for people who don't know, if you want to look it up, just look up
It's great.
painrevolution.org.
Mm-hmm.
So we will be riding bikes over 100 kilometers every day to rural and remote communities. And when we get to the community, we are going to be teaching the healthcare people about pain, but also teaching the community people about pain. And in each of those communities, one of the people who, one of the healthcare people, we're raising money for them so that they can actually go to the University of South Australia to become much more of a leader in understanding about pain and pain topics. And so it's really about increasing accessibility to good pain care, but also about pain literacy, both, so knowledge within the community and within the healthcare people. And so my plan is to go down there next March and do it.
Nice.
And do the ride. And this will be fun because we're going to be riding all day and then doing education every evening, which will be really an amazing task. And then my plan is to bring it back to Canada and see how we can figure out how to do something similar. It would be different, but something similar.
Yes, that would be awesome. Yeah. Much closer for me to participate in than Australia.
Well, it's nice riding in your land too, right?
Yeah, it is. It's beautiful.
Yeah.
It's totally beautiful. Yeah, and I haven't thought about that. Why don't we have like a US? It should be, international everywhere. We should all.
They've got as far as I understand, they actually have the Australian government is
Wow.
backing them to a certain degree. I mean,
Wow.
it's and in Canada, there's a national pain task force happening right now, and I know in the United States, it's the it's the Consortium of Integrated Pain Medicine or Pain Management. Over 177 agencies in the United States are together trying to figure out how do we address this because it's so huge.
Mm-hmm.
The cost to, there's the cost to society, but then there's the cost to us as individuals because,
Right.
Pain changes everything. And
Yeah.
I don't know if most of your listeners really know if you've got pain, you get it. But if you don't have pain, you may not recognize that the personal cost in terms of losing relationships and work and your house and
Mm-hmm.
Even the risk of suicide goes way up when people have chronic pain,
Right.
and people don't really recognize that. But we're getting I guess my point is that we're actually getting people who have some capacity to help. Some government agencies are starting to actually pay attention to this and recognize it's something that needs to be coordinated from a national perspective.
Mm-hmm.
Even though just like in Canada, our ministries of health are provincial, like yours are in states. But without that overarching body to help coordinate things, it's really hard to get it done well. Yeah.
Oh, and we're just starting to unravel and collect our resources, like you're saying, Neil, like just start somewhere and spread the message one person at a time. And it's so wonderful that we have these larger institutions and the government backing up a lot of these efforts to help shift the pain paradigm. So it's wonderful. Thank you for all the work that you do and that you continue to do and collaborate with. And I can't thank you enough for being on the show. Thank you so much. Are there any ways that the listeners can reach out to you or learn more about you and your practice?
Sure. So there's my main website is paincareu, like the letter U, .com. And so if you go there, that's got more of my current things on. Mm-hmm. If you're a person in pain and you wanted to access some free stuff, there's some free stuff on the paincareu.com website. But there's another thing that I've created called First 5 Steps, and it's free. So step 1 provides you with some understanding about pain. Step 2, a breathing practice. Step 3 is a body tension releasing practice. And step 4 is a movement guidelines. And it's totally free. It doesn't ask you for your email address or doesn't take your IP, none of that stuff.
Nice.
And so that's a different site, though.
What's
so
to
get that, you go to lifeisnow.ca.
Got it. And
so
I'll link that.
It looks like Life is Snow, but it's actually Life is Now.
It does look like that.
And because I'm in Canada, sometimes people think that it must be life is snow.
Oh, right. Life is snow, like a snow globe,
Yeah, there you go.
lifeisnow.ca. Wonderful. And
Yeah,
I'll link
That's great,
for the
yeah.
listeners in the show notes so they can easily access that. Thank you so much for
Wonderful.
making that accessible for everyone, and really for the wonderful work that you're doing in collaboration with a lot of other individuals like myself and Lorimer and David Butler and Sandy Hilton and Sarah High and Shelley Prosco and Marlissa Sullivan and all these people. And then we stand, and if I didn't mention you, I'm sorry, but it's we stand on the shoulders of giants, and I love that we're all kind of getting together to share this message. It's very powerful and hopes to really help people alleviate their suffering. So thank you so much, Neil. I really appreciate you.
Thanks for giving me the opportunity to share this.
Wonderful. All right, listeners, thank you so much for being here. Thank you so much for following. And until next time, in loving wellness for your pelvis, this is Dr. Susie G signing off. Bye.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear your feedback. Thanks again.
You have pants, don't you?